Welcome to the deep dive. Today, we're digging into something pretty serious.
Yeah, a really significant data breach that happened last year, Nationwide Recovery Services, NRS.
Exactly. And the fallout has been huge, affecting, well, loads of healthcare organizations and, more importantly, a vast number of people. Their personal data got exposed.
Right. So what we want to do today is really unpack this, figure out what went down, who got caught in the middle, what kind of info we're talking about.
And crucially, what it means legally and practically for everyone whose data was compromised.
Absolutely. We're aiming for clarity here, trying to make sense of a complex situation and pull out the key takeaways.
Okay, let's jump in. But first, a quick word about our sponsor, Stonefly.
Ah, yes, Stonefly. They are real leaders in enterprise storage, backup and disaster recovery, AI storage, and cloud solutions.
And if you're looking for truly secure, ransomware-proof storage, they've got options like air-gapped and immutable storage. Really top-tier stuff.
Definitely worth checking out. You can contact them at sales@stonefly.com to schedule a demo. Okay, so this NRS breach. Where do we even start? The timeline.
Yeah, let's start there. It seems the actual trouble started quite a while ago, middle of last year.
That's right. The information points to the breach itself happening between July 5th and July 11th, 2024.
Just a week-long window.
Apparently, during that time, someone got unauthorized access into NRS's internal systems, and they didn't just look around. Data was actually taken out.
Okay, so they noticed suspicious activity, which then triggered an investigation by NRS.
Correct. But here's where it gets interesting, maybe. Or concerning.
The notification part. Yeah, I saw that. It wasn't exactly speedy, was it?
Not at all. The breach was July 2024. NRS is a subsidiary of ACCSCIENT, by the way. They didn't actually start letting their clients, the healthcare providers they do debt collection for, know until around February 10th of this year.
February 2025. That's, what, 7 months later?
Uh-huh. A really significant delay. And that delay itself has some pretty serious implications we need to talk about.
Okay, so who were these clients? We're talking healthcare providers, but how many? How many people are we actually talking about here? It sounds massive.
It is massive because NRS works for so many different healthcare providers, collecting debts. The breach just rippled outward.
Like a domino effect.
Exactly. And we've seen quite a few of these clients come forward now, acknowledging the breach and giving estimates of how many of their patients were affected.
Can you give us some examples just to get a sense of the scale?
Sure. So Rhea Medical Center, they reported over 8,000 patients.
Okay.
Hamilton County EMS, the ambulance service, that was around 14,000 patients.
Wow.
Even the City of Chattanooga, acting as a provider, had 836 people impacted. And then you get to the really big ones. Harbin Clinic.
Yeah.
They're in the process of notifying over 200,000 people.
200,000 just from one clinic. That's staggering.
It really is. And it doesn't stop there.
Oh, no.
No. We know several other big health systems were hit. Hamilton Healthcare System, they also go by Vitruvian Health, Erlanger Health, DRH Health, Elbert Memorial Hospital. They've sort of collectively reported being impacted, affecting more than 110,000 individuals across those organizations.
So add another 100,000 plus to the tally.
Yep. And Swedish Edmunds Hospital also reported being affected, although they haven't given a specific number publicly.
So it really hit all sorts, didn't it? Big hospital systems, smaller clinics, even like county EMS services.
Exactly. It shows how interconnected everything is, especially when you use third-party services like a debt collector.
And the scary part is that might not even be the full picture, right?
That's a crucial point. NRS has licenses to operate in all 50 states, all of them. And they haven't actually released a full list of every client that was affected.
So the total number could be much, much higher than what we even know right now.
It's very likely, yes. Potentially hundreds of thousands more.
Okay. Let's shift gears slightly. What kind of information actually got out? We know it's bad, but how bad? It wasn't just names and addresses, was it?
Oh, I wish. No, the data categories are, they're incredibly sensitive. We're talking full names, home addresses.
Standard stuff, unfortunately.
Right, but then add social security numbers. That's the big one for identity theft, obviously. Dates of birth, too.
Okay, that's already a nightmare combination. SSN and DOB.
Exactly. But wait, there's more. Financial account information was also in there.
Like bank account numbers, credit cards.
The reports mention financial account information, yes, and government-issued ID numbers, like driver's licenses, perhaps.
Jeez.
And then the really critical part for healthcare breaches, medical information, protected health information, PHI. That got exposed, too.
What does that include? Diagnosis, treatment details?
It included the names of the healthcare providers people used. And in at least one case, Harbin Clinic, it even included details about the guarantor, the person responsible for paying the bill.
So you put all that together, name, address, SSN, DOB, financial info, government ID, and medical provider info. That's basically a complete identity kit for a criminal.
Pretty much. It's incredibly valuable data on the dark web. The combination of financial and medical data is particularly potent. It allows for very targeted fraud, not just financial, but potentially medical identity theft, too.
Which can be devastating, messing with someone's medical records.
Exactly. This is why healthcare data breaches are taken so seriously. The potential for harm is just exceptionally high.
Which brings us neatly to the legal side of things. IPA, the Health Insurance Portability and Accountability Act, must be central here. How does it apply?
Absolutely central. The HIPAA breach notification rule is key. It applies to what are called covered entities. Think health plans, healthcare clearinghouses, and most healthcare providers who handle health info electronically.
Okay.
And importantly, it also applies to their business associates. That's where NRS fits in, organizations that handle protected health information, PHI, on behalf of a covered entity.
So NRS, as a business associate, handling patient debt info, falls under IPA rules.
Correct.
And what exactly does IPA consider a breach? Is any unauthorized access a breach?
It's defined as the unauthorized acquisition, access, use, or disclosure of unsecured PHI that compromises its security or privacy. The key word there is unsecured.
Unsecured. What does that mean in practice?
Well, IPAA guidance strongly encourages rendering PHI unusable, unreadable, or indecipherable to unauthorized folks. Think strong encryption for electronic data or proper shredding for paper records.
Right.
If the data is secured according to HHS standards, like through proper encryption, then even if someone accesses it, it might not technically be considered a breach requiring notification because the information itself remains protected.
So hypothetically, if NRS had encrypted all this data properly,
Then this whole notification nightmare might have been avoided or at least significantly lessened because the data, even if stolen, would be useless without the decryption key.
which underscores the importance of encryption. But clearly the data wasn't adequately secured here.
Apparently not, given the widespread notifications now happening. And remember, unsecured PHI isn't just digital files. It can be paper records, even things said orally, if not properly safeguarded.
Okay, so a breach of unsecured PHI happened. What are the obligations then under HIPAA, especially regarding that notification delay we talked about?
The rules are pretty clear. Covered entities must notify affected individuals without unreasonable delay, and absolutely no later than 60 calendar days after the breach is discovered.
60 days, not 7 months.
Precisely. They also have to notify the Secretary of Health and Human Services, HHS. If it affects more than 500 people, that notification to HHS has to happen pretty quickly, too, within that 60-day window.
And in some cases, the media as well.
Yes, if 500 or more residents of a single state or jurisdiction are affected, major media outlets in that area must also be notified, again, within 60 days of discovery.
Now, what does discovered mean legally? Is it when they first saw something fishy or when they confirmed data was taken?
Good question. It's considered discovered on the first day the breach is known, or the date should have been known if the entity had exercised reasonable diligence. So you can't just ignore warning signs.
Okay. And what about the business associate, NRS in this case? Who tells who?
The business associate, NRS, is required to notify the covered entity their client, like the hospital or clinic, of the breach. But, and this is important, the ultimate legal responsibility for making sure individuals and HHS get notified properly rests with the covered entity.
So the hospitals and clinics are on the hook legally, even if their vendor messed up.
They hold the primary responsibility for patient notification under APA, yes, though, as we'll see, they might have legal recourse against the vendor.
Right. And what information has to be in that notification letter to people?
It needs to be in plain language, easy to understand. It must describe what happened, including the date of the breach and discovery date, if known. It has to list the types of PHI involved, like did they get your SSN, your medical info, etc. It also has to recommend steps people should take to protect themselves, explain what the entity is doing to investigate and mitigate harm, and provide contact info for questions.
Seems comprehensive. Now, you mentioned legal recourse. What's happening there? I heard Chattanooga wasn't happy.
That's putting it mildly.
Yeah.
The City of Chattanooga explicitly said they're looking into legal action against NRS.
On what grounds?
Failure to meet contractual obligations. Basically, they argue NRS didn't notify them quickly enough as required by their contract and didn't provide the necessary support services to affected individuals promptly.
And didn't the city council do something else?
They did. They voted to rescind, basically cancel their contract renewal with NRS. That sends a pretty strong message about the loss of trust.
Yeah, you could say that. It really highlights how damaging these delays can be, not just for individual, but for business relationships too.
Absolutely. It erodes trust all around. Individuals feel let down because they weren't told sooner, and the client organizations feel let down by their vendor.
So what has NRS said they're doing about all this? What's their official response been?
Well, NRS has put out statements saying they've taken steps. They mention implementing additional data security safeguards. Vague, but okay. They also say they've reviewed their internal policies and procedures.
Standard corporate response, maybe?
Pretty much, seems like it. They also stated they notified law enforcement and the credit monitoring bureaus.
Okay. And what about helping the people whose data is now out there? Are they offering anything?
Yes, they are offering identity theft protection services through a third-party provider called IDX.
What does that usually involve?
Typically, it includes credit monitoring, keeping an eye on your credit reports for suspicious activity, often for 12 or sometimes 24 months, and also cyberscan monitoring, which watches for your info on the dark web.
Is there insurance?
Yes, usually there's an insurance policy included, often up to $1 million, to cover certain costs if you do become a victim of identity theft because of the breach. And they also provide identity recovery services, meaning experts help you fix the mess if your identity is stolen, all offered at no cost to the affected individuals.
Okay, that's something at least. So if someone gets one of these letters saying they were affected, what should they do? Like, right now?
First thing, absolutely the first thing. Sign up for the free credit monitoring IDX is offering. Don't put it off. Activate it immediately.
Okay, activate the monitoring. What else?
Keep a very close eye on your credit reports yourself. You're entitled to free reports from each of the 3 main bureaus, Equifax, Experian, TransUnion, every year. Go to annualcreditreport.com, that's the official site. Check them carefully for anything you don't recognize.
Good advice. Any other protective steps?
Yeah, seriously, consider placing a fraud alert on your credit files. It makes it harder for someone to open credit in your name. Or, even stronger, a security freeze.
What's the difference again?
A fraud alert just flags your file, requiring lenders to take extra steps to verify identity. A security freeze actually locks down access to your report, preventing new credit from being opened unless you temporarily lift the freeze yourself. It's more restrictive, but offers more protection.
Got it. So monitor, check reports, consider alerts or freezes, and just generally be wary.
Exactly. Be vigilant. Watch your bank accounts, credit card statements, even medical bills or explanation of benefit statements for anything weird. Report any concerns right away, either to IDX or directly to your bank, credit card company, or the authorities if necessary.
You know, this whole mess really highlights some bigger issues, doesn't it?
Oh, absolutely. It's a stark reminder of the risks involved when organizations hand over sensitive data to third parties. Your security is only as strong as the weakest link in the chain.
And that chain can be long and complex.
Very true. It really hammers home the need for robust security, not just internally, but vetting your vendors and ensuring security practices are strong everywhere data flows.
And that whole timeline issue we discussed, the gap between the breach, NRS telling clients, and clients telling people, that seems like a systemic problem.
It certainly raises questions about communication efficiency. Timely notification is crucial. The longer people are unaware, the more damage can potentially be done with their stolen information. We need faster, more transparent communication when these things happen.
So, wrapping this up then, the key takeaway is that this NRS breach from last July was huge, hitting many healthcare providers and potentially hundreds of thousands, maybe even more, individuals.
Right. And the data involved was extremely sensitive. SSNs, financial info, medical details. So the risk is real.
And if you were affected, the immediate advice is activate the monitoring, check your credit reports constantly, consider freezes or alerts, and stay vigilant.
Couldn't have said it better. Take those protective steps now.
Which leads us with a final thought, really. We live in this world where our data is everywhere, shared between so many companies. So the question is, what can we individuals and organizations realistically do before a breach happens to lessen the impact? And maybe more importantly, how do we push for faster, clearer, more accountable notifications when breaches inevitably do occur?
That's the million-dollar question, isn't it? Something we all need to think about.
Indeed. Thanks for walking us through this complex situation today.
Glad to shed some light on it.
And one last thank you to our sponsor, Stonefly. They're leaders in enterprise storage, backup, disaster recovery, AI storage, and cloud solutions.
That's right. If you need serious ransomware-proof storage, think air-gapped, immutable options, Stonefly is definitely worth looking into.
You can reach out for a demo at sales@stonefly.com. Thanks for listening to The Deep Dive.